Can you prevent mucositis during cancer treatment? Mucositis is a painful condition that can occur during cancer treatment, particularly from chemotherapy and radiotherapy. It involves inflammation and ulceration of the mucous membranes, often affecting the mouth and throat. The good news is that there are ways to partially prevent mucositis or lessen its severity. Let's explore some evidence-based strategies that can help manage this side effect effectively. One promising approach is low-level laser therapy. This method uses specific wavelengths of light to reduce inflammation and promote healing in the mucosal tissues. Clinical trials have shown that it can be effective in preventing oral mucositis in patients undergoing various cancer treatments. Another strategy is cryotherapy. This involves using cold therapy, such as sucking on ice chips during chemotherapy infusion. The cold can reduce blood flow to the oral mucosa, limiting the exposure to chemotherapy drugs and potentially lowering the risk of mucositis. For patients undergoing high-dose chemotherapy or total body irradiation before stem cell transplantation, palifermin may be an option. This is a recombinant human keratinocyte growth factor that helps promote the growth of epithelial cells and tissue repair. However, it is generally reserved for specific high-risk treatments due to cost and concerns about stimulating cancer cell growth. Anti-inflammatory agents can also play a role. Mouthwashes containing benzidamine have shown some effectiveness in reducing inflammation associated with mucositis. Additionally, antioxidants like amifostine may help protect mucosal tissues by scavenging harmful reactive oxygen species generated during treatment, although their use is limited by inconsistent evidence. Mucoprotective agents and mouthwashes can also be beneficial. Certain antimicrobial rinses and formulations containing erythropoietin have been associated with a reduced incidence or severity of mucositis. Maintaining good oral hygiene is crucial. Regular dental checkups, gentle brushing, and flossing can help minimize mucosal injury. It is also important to avoid irritants like alcohol and tobacco. While some herbal medicines and supplements have been studied, their effectiveness is less certain. They should not replace standard preventive measures. It is essential to remember that prevention strategies may vary based on the type of cancer, treatment regimen, and individual patient factors. For cancers like testicular and cervical cancer, which may involve chemotherapy or pelvic radiotherapy, a tailored prevention plan is vital. Patients should always consult their oncology care team to develop a personalized mucositis prevention plan. Early intervention and supportive care can significantly improve quality of life and help maintain adherence to cancer therapy. In summary, while mucositis cannot always be completely prevented, various validated interventions can reduce its incidence and severity during cancer treatment. These include low-level laser therapy, cryotherapy, palifermin, anti-inflammatory agents, antioxidants, mucoprotective mouthwashes, and diligent oral care.